Good morning. In this video, I'm going to be demonstrating some exercises from a specific post-surgical total knee replacement rehab program. The program is a PDF file. I'm showing you how the exercises look in real life. So the first exercise I'm going to demonstrate is called an ankle pump. Now this can be done laying flat or it can be done laying on an incline. Usually it's done in bed. And if I'm laying back in my bed, we're pretending that it's a left total knee replacement. What I'm going to be doing is pulling my toes back and pointing my toes forward. Now, I'm going to remove my shoe so I can demonstrate a little better. You can see I pull my toes back, I flex the ankle, then I extend the ankle by pointing my toes down. The intent of performing this exercise is to help pump some of the fluid out of the lower leg. Assuming there's going to be some swelling on the knee when you're up on your feet or in a seated position, that fluid is going to drain down into the foot and ankle. This is one way to start to move that fluid, support the lymphatic system, and get that fluid back into circulation. A better way to do an ankle pump is to elevate the leg. So in some cases, what we would do is we would arrange pillows on the bed so that the leg is higher. If you can imagine, I'm laying in bed just like this, and now I'm going to perform the same ankle pump exercise but with the leg elevated to between 30 and 45 degrees. I'll perform 20 to 30 repetitions 3 to 4 times a day. The second exercise in the series is called a quad set or quadriceps set. So this muscle of the upper thigh is called the quadriceps muscle. It's made up of 4 separate muscles. And when you're doing a set exercise, what you're doing is you're tightening the quadricep and then relaxing. There's a little bit of movement because when the muscle contracts to tighten, it shrinks together and becomes firm. Then when you relax, the muscle becomes soft. Now, a lot of my patients after a knee replacement, especially if they've used a tourniquet during the procedure, will have a lot of thigh pain. They'll have a lot of weakness in this muscle. They won't be able to lift the leg because that muscle is impaired from the tourniquet damage. That's okay, that's common. What you're gonna do though is you're gonna work on tightening the muscle and relaxing. One of the main mistakes that happens is patients think, well, if I'm gonna tighten that muscle, that means I have to lift the leg. If you find that you have a tendency to do that, you can place a pillow underneath the knee. And then what I'm doing is I'm tightening the muscle and I'm pushing down into the pillow. Pushing down into the pillow will tighten the glute and the hamstring as well, but it's one way to activate the quad muscle without thinking of flexing the hip. So again, quad sets, you would typically do this 20 to 30 times. You would repeat it 3 to 4 times in a day. The next exercise in the series is called glute sets. Now, glute sets could be done seated, they could be done laying flat, they could be done in just about any position. But just like the quadricep, the glutes are the muscles behind the hips. When you squeeze them together, when you clench those muscles together, there's going to be a little bit of movement. They're going to become tight and firm, and then you relax. That's called glute setting. You would repeat that 20 to 30 times. You would do this 3 to 4 times in a day. The next exercise in the series is hip abduction and adduction, abduction and adduction. So the way they show it in the picture is they put a pillow between the knees. Your toes are going to be pointed straight up the best you can. And then what you're going to do is you're going to slide the leg out to the side and then you're going to bring it back into the midline. In this case, I'm going to scoot over so I have a little more room. Again, my toe is pointed straight up. I'm sliding out and I'm bringing it back together. I find that this is challenging on a bed or even on a couch or the floor just because of the friction and the difficulty with moving the leg. So a lot of times what we'll do is we'll just have our client roll to the side. So if my left total knee replacement is on the bottom in this case, I'll do an abduction of the top leg so that I can see what the non-surgical leg is doing. Once I've done a set of 10, I can switch and I'll do the same thing now with the surgical leg on top. We would do 10 repetitions. If for some reason you're not allowed to lay on your side, possibly you have a hip replacement or some other pathology going on, you just find a different way to do it. I personally, as a physical therapist, prefer to do these exercises standing. So if I was gonna stand, I would stand straight, hands on a kitchen counter, and I would raise my leg out to the side. 10 repetitions, 3 to 4 sets, once or twice a day. Probably one of the most common exercises following a total knee replacement is called a heel slide. It can be done assisted or unassisted, but basically what we're gonna do, this is the side that we're assuming was replaced. I would flex the knee and slide my heel toward my bottom, and then I would slide it back down. Yes, we're bending and extending the knee with this exercise. The friction of the foot on the bed or whatever surface you're on is gonna provide some resistance. If I have the ability to lift the leg and I don't have the ability to work against the friction, what I could do is I could lift from the hip, I could bend the knee in as far as the incision and the post-surgical wound will allow, and then I would lift and put it back down. So it's an up and in, up and out, but the way the exercise is traditionally taught is to slide in, slide out. You can use your hands to assist. Sometimes this might make it a little bit easier. You could use a strap around the foot to help pull it into this knee flex position. This would be repeated 20 repetitions, 3 to 4 times a day. The next exercise in the series is called a short arc quad. And typically what you would do is you would place something, a folded up pillow, a towel roll, something under the upper thigh so that the knee has a little bit of support and it's elevated from the surface you're on. So you can see here I'm about 6 inches up from the top of the plinth, the mat that I'm laying on. And to do the short arc quad, what I do is, again, just like we did with the quad sets, I push down, I tighten the quadricep muscle, but this time because my thigh is elevated, what happens is my foot will actually lift just a couple inches. What patients tend to get wrong with this exercise is they try to do a straight leg raise, which is a different exercise. What we're trying to do here is tighten the quadricep, tighten the glute, push down into an object so that the foot comes up just a couple inches off the surface. We would repeat this 20 to 30 times, 3 to 4 times a day. Now the next exercise is a straight leg raise. And so when I'm doing this, the first thing that I'm trying to do is tighten the quad, tighten the glute so that the leg is as straight as it will allow. From here, I'm lifting the leg 12 to 16 inches off the surface and then letting it come back down. A couple ways that you could work with this. If there's been a tourniquet used, oftentimes there's going to be some thigh weakness, quadricep inhibition. What I can do is I can bend my non-surgical side. And what I'm thinking is I'm pushing my non-surgical side down as I lift my surgical side. So I tighten my right glute, my right hamstring, I'm pushing down into the table. And as a result, the left surgical side will start to rise. I would repeat this 20 to 30 times, 3 to 4 times a day.